We're here with Dr. Chatterley. Good morning, Dr. Chatterley.
Good morning. How are you doing?
Good. Dr. Chatterley, let's talk about some of the news which has been out there recently about adhesives for dentures, denture creams, and that they seem to be having too much zinc in it. And because even though the body needs zinc, apparently when the cream is, around the gateways of the blood vessels, too much of it goes in. And people, apparently, it's obviously not totally proven, might get nerve damages. They get tingling in their feet, they get in their hands, they get numb muscles, they get all those little things. And some cases have been rather severe. What did you hear about it? What's your opinion? How can one fix that? How can one prevent things like that? And don't need to worry about it.
Well, the best way to prevent it, obviously, is not use it. And I'm sure it has a cumulative effect. Somebody uses those adhesives over several years. As their denture, their foundation, the ridge under the denture changes and recedes, then they need to use it more and more. So they're exposed to it on an ongoing basis. And there's other solutions that have been developed and refined in the last 5-10 years that would answer the condition much better than adhesive, and that is to have small implants placed that denture can affix to, and they wouldn't have to use the adhesive. They have a lot better retention with their denture. It's just a win-win all the way around.
Okay, I see. So, yes, we've heard about it. So basically a person, he might be using his old denture, but he might not be using his old denture if they're already a little bit out of alignment and a little wiggle-woggly. He might need new denture, but basically you supplement the denture with a couple, 2-3 implants, and then the denture snaps on it. And by doing so, the denture will never be shifting and have room in it to kind of like float around like a boat. And by doing so, he never needs the adhesive at all. That's what you're saying.
Exactly. That's been the experience of a lot of happy patients that have been denture wearers for years. It's been the answer to their lower denture problem, which has been, I tell patients, the curse of dentistry, because it's just a real struggle to get a successful lower denture over many years. It gradually, the condition worsens, doesn't fit, doesn't float around. Mm-hmm. So it's a big solution.
Right. But even, I've heard that this implant-supported denture, I call them hybrid dentures, they're definitely having many, many other advantages. Is it true that with a denture, upper, lower, that you can eat and bite almost or pretty close to as good as if you would have a full set of implants, or for that much a full set of real teeth?
I can't remember the exact pounds per square inch and the statistics, but absolutely the percent increase in the efficiency of the denture is phenomenal, and it makes a tremendous difference that can't be accomplished with adhesives.
Yeah. Because even if a person, we know that when we walk around with something which feels loose on it, or we worry about it being loose, worry about a shoe coming off, worrying about a zipper coming off only because it once did, or something like that, we feel immediately uncomfortable. And so people, I heard that, who wear dentures, even if the dentures not necessarily ever really come off while eating and talking, they feel a little apprehensive, so they kind of are holding back, and the whole demeanor becomes a different ballgame. And then dentists like you tell me, when they do change to an implant-supported denture, that just goes away, and they feel like new again. They smile, they open their mouth again. And for instance, you mentioned the lower denture problem, but on the upper denture problem, a person with not dental implant-supported denture, he has this plastic or metal right over his palate, and by doing so, doesn't really taste the food anymore as good as he should, or not at all for that purpose. And yet with implant-supported denture, that goes away again, and the person can completely taste the food again. Is that true?
Oh yes, there's a lot more flexibility. They don't, with the implant supported, then they don't need the full palatal coverage, so they don't have that feeling of oddness, or the lack of the feeling they once had when they were able to chew the food without the plastic cover. The success of the upper denture without implants, just a regular upper denture, is the seal on a flat surface. And so if you try to cut out that palatal area, well, then the success of the denture is minimized. However, with implants, you can have the best of both.
Right.
You can have the...
Right. And if you know, as you mentioned, there is a couple, maybe 2 or maybe 3 implants, which is, yes, a little more than a regular denture in terms of money, but a tremendous amount of less than a full set of implants, and yet you get pretty close to the same effect in terms of leading life again. So that looks like a good deal to me, with no doubt, because a couple implants are really not all that expensive. You know, people who have a missing tooth or two need that type of stuff, or they need a bridge, and it's about the same money. So we're not really talking major here. Now, would you suggest that a person who is or has been wearing adhesives, and he does feel a little bit of, you know, a little funny, he feels a little numbness, he feels a little weak muscles, he feels a little tingling in the muscles, or other kind of slight dizziness and little things like that, restlessness, would you suggest him to visit a physician or somebody who does nerve testing and see to make sure everything is fine, and then of course also come to a dentist and make sure that he never needs to use it anymore?
Oh, absolutely. If they have those symptoms like you mentioned, definitely they should start with their family practitioner, and probably most likely get referred on to a neurologist for consideration if there's a problem, and the sooner the better, and then get get the treatment necessary to halt or reverse the process, and then they can elect to do an alternative like placing implants to help support the denture.
Good. Well, very informative, Dr. Chatterley. Thank you very much.
You're welcome.